Hello and welcome to the Dr. Brian McDonough Show. Today we have a very special show. We're going to be talking about the heat issue we have in our country right now, global warming, you might want to call it. Whatever you want to call it, we're going to talk about heat and the issues surrounding it and what we can do to help. Joining me now is Dr. Stephanie Malleus. Dr. Malleus is a family physician from Wilmington, Delaware. Dr. Malleus, welcome.
Thank you. It's becoming more and more obvious that there are more and more negative impacts of extreme heat on people who live in Delaware specifically. And they felt that there needs to be more focus so that people are aware of the problems and what they can do to mitigate some of the harms. I think our interest, of course, is in the medical, where medicine and health cross with climate. There are two organizations that kind of spearheaded this. One is the Mid-Atlantic Alliance for Climate and Health, which is an organization of many people and organizations in the health field that have a concern about climate in general as it relates to health. And then the University of Delaware. However, those two groups went together and encouraged the state to proclaim this. And then, so what we've done is we've gotten lots of partners, cooperating partners. We have about 30 of them. The deal is that all of those organizations are trying to develop activities, talks, kickoffs, events, teach-ins, all kinds of community events around this week. It's from May 18th to May 22nd. And so each day is going to have a different focus.
I think you're making a number of good points, Dr. Malleus. First of all, for people around the country who are watching this, it's a problem. It's universal. It's an issue. But I know a lot of communities are doing very similar things and they're trying to. But what I like about it is, students from the University of Delaware got involved and they helped motivate it. It was residents from St. Francis Hospital, people from Christiana Hospital. I mean, there's people who in the community are saying they're going to do what they can to try to help others deal with it. But I think also, I would have to admit, raise awareness about we are starting to see hotter and hotter temperatures.
Well, right. I mean, after the winter we've had, it's hard to believe that this last year was one of the hottest on record. If you look at the projections for Delaware, they're just pretty, the curve goes right up. I think, it's clear that most of the heat, the excessive heat, is created by the use of fossil fuels. But the fact is that even if we stop using fossil fuels today, the temperature would continue to increase from that previous use, for another decade or two. It's quite a while. Extreme heat days are defined as more than a day of heat over, in our area, it would be over 90. In some other areas, it's over 100 degrees. And we hit those days occasionally now. But, I'm focused on this more from the medical, point of view. And there are a myriad of medical problems that just worsen so much with increase in heat. And there have been good studies on this. I mean, the New England Journal and, it's very well documented that when the heat goes up for several days, there are many more deaths from pulmonary disease, because partly because the PM 2.5, the particulate matter in the air, increases, and it basically increases the pollution, and people who have lung problems find it harder to breathe. So you get more people getting sick and dying from pulmonary problems, and also cardiovascular problems, big problem. Other issues that I think people probably realize are people who, as you said, workouts. We already mentioned work outside, but elderly people in the city who can't perhaps get an air conditioner, don't have windows that work. Older people frequently don't feel the effects of heat that they're experiencing. They don't feel hot when they are hot. And so we get a lot of people who maybe are on diuretics and shouldn't, need to adjust those when it gets hot, and need to find cooler places to go and know what to do. If the temperature's high, they say, okay, well, I have to do this adjustment in my medicine, or these are things I need to do. So those are the kinds of things that we're looking at. Another thing that you might not think about very much is that the rate of premature birth goes up when the temperature goes up for a lot of very technical reasons, and maternal health is also way affected. And there putting a whole day focused on that in the week. Violence increases, and they see like a big increase in emergency room visits.
Well, Dr. Malley, it's just fascinating, and I appreciate, first of all, everything you're doing in Delaware, but also the awareness you're raising. And I'm going to bring two more people into the podcast. First, I'm going to bring in Dr. Bargier, or Dr. B, who hosts a podcast for the Delaware Academy of Family Physicians. And also, I'm going to bring in Dr. Samuel Brosman. Sam Brosman is a resident at St. Francis Hospital who's actively involved with other residents at the same facility, trying to do what they can to help people during this week. But Dr. Malley, thank you. Really, I appreciate your joining us. It was great to hear what you had to say, and thanks for all the work you've done.
It was a pleasure coming out for the week. Take a look and join us.
Dr. B, you take over. You got your own podcast, so you don't need me. So I'll let you talk with Dr. Brosman.
All right, sure. I actually want to let Dr. Brosman start by introducing himself. I last saw him 10 months ago. And since then, from what I've heard, he's grown to be an exemplary resident and leader. So why don't you tell us a little bit more about this project you're doing, who you're doing it with, and what are you guys working on?
Yeah, so excited to talk about this. So I'm Dr. Samuel Brosman. I'm a second-year resident at St. Francis in family medicine. And it's been a little bit of time since Dr. Bargier and I have caught up. She was one of my excellent seniors, so I can't take all the credit to myself. A lot of it has to go to her. But Dr. Malleus and I originally started talking about Heat Week and heat awareness after she gave a lecture to the residents on the climate and some of the potential adverse effects that it can have on our community. And what kind of caught my eye was that there's about a 20 to 40% increase in all-cause mortality during extreme heat events. And this goes over asthma, COPD, cardiovascular disease, an increase in maternal and fetal mortality, and overall just ER visits if it's for mental health or violence. And it causes a significant drain on the healthcare system. And a large part of family medicine, as we know, is about preventative medicine. So the residents, myself and two others, Dr. Haridi and Dr. Henriquez, have been trying to get involved and think of some steps that we can do to create awareness and provide some safe spaces and opportunities for our community.
That's excellent. And what are some of these projects that you guys are working on to mitigate the problems for the people in the community?
Yeah, so we have our hand in a couple of different pots right now. The hospital has been a huge support for us. The residency program has been a huge support backing us as well. Personally, what we're working on between the three of us is, one, identifying our patients who could be at risk. So using our EMR to find these patients that are more at risk of being impacted by extreme heat based off of comorbidities or socioeconomic status, and finding a way to reach out to those patients and make sure that they get the information and resources they need. Another thing that we're not necessarily headlining anymore, but Healthy Village at St. Francis Hospital is planning for more of a cooling space or cooling center where people of the community will have somewhere to go to stay cool, get in the air conditioning, have some water, and kind of escape the heat for a few hours of the day when it's at its highest or at its peak. And then just spreading some awareness. So finding ways to use our EMR to our advantage, whether that be creating some sort of handout with information on where to go, what to do, how to plan for these peaks in heat, that they can have something to take home with them in their after visit summary, and then utilizing the opportunity in the office to talk to them and educate them on things to do. We're also in the steps of creating or formulating some sort of poster to help spread awareness, encourage patients to ask their doctor about extreme heat or how to stay safe. And then additionally, we would like to kind of utilize our home visits where we have our regularly scheduled appointments with patients who can't necessarily make it into the office, so we can provide similar education. And if it's possible, utilize some of that time and the time that we've used to identify at-risk patients. If we can't reach them at their home or reach them in the office, maybe even utilize some telephone visits or try to make some phone calls to spread the same kind of awareness, and then hope that word of mouth gets out as well.
All right. So from my experience, we always have these resources available. And from the looks of it, you guys have done an excellent job identifying those at risk and finding like a strategy to kind of get the resources to them. But then for everybody else that's perhaps not as involved as St. Francis or doesn't have our resources, like how do you put the word out of what you're doing and how everybody else can use it? Or like how do you take the word to the community or the people who don't come to a residency clinic about what you guys are doing and how they can take advantage of it?
Yeah, I mean, that's going to be a huge barrier to get through, right? Like you can only get to so many people in the clinic, or you can only get to so many people that are passing by the hospital or through the main entrance where they may see these posters. We actually did have a meeting with a few other, I guess, outreach communities in here in Delaware and the University of Delaware that are doing similar things. And there are some cooling centers or spaces in other areas, but not necessarily right in Wilmington where St. Francis is. So kind of our hope is that through word of mouth, if people tend to have habits of tending to go to certain spaces or certain places, then they may be able to spread awareness like, oh, there is also this place here. This is available for us. If we can get our posters out there and that can tell people where these locations are, that can encourage people to come by St. Francis or encourage our patients to talk to their families, to talk to the ones that they're worried about or that they think may be at risk in the future. And if they have somebody they want us to reach out to, I mean, we'd be more than happy to add them to our list as we're compiling them to find someone else that if there could be at risk to try to reach as many people as possible. So word of mouth isn't always the best, but we're gotta have to hope that it's on our side for this one, as well as the posters and utilizing our population that we already have in the clinic.
So we know that these increased temperatures kind of increase the risk of certain medical conditions, but I guess most people just think of like heat just causing heat strokes. Are there any other medical conditions that sometimes go into exacerbation, especially for patients who are elderly or have multiple comorbidities and they get worsened by this increased heat?
Yeah, absolutely. I think you kind of hit the nail on the head right there. We think about the heat and we think about heat stroke or someone maybe in a summer practice and they passed out. But there's so much more. There's so many people who are at risk, and it's almost the entire population that we see in family medicine. I mean, you start at infants and newborns are more at risk. And then you think about the elderly people over the age of 65. Then you think about anybody who has pulmonary disease, an asthma or COPD. They should be thinking about what steps they need to take in preparation for the warm weather or the very dry heat that they could be going through. And if they need to have their inhalers, if they have good maintenance therapy, if they need a new as needed medication, or people with cardiovascular disease. Dr. Malleus talked about it a little bit. If you're on a diuretic, if you need to stay hydrated, but you need your diuretic as well, if there needs to be any sort of adjustment with that medication, which is why it's important for us as family medicine physicians to bring this up. Or as a patient, if you have questions, ask your doctor. We should encourage them to ask questions, to go over our medications every chance we get the chance to see if we can make any adjustments to prevent these exacerbations, to keep our patients safe, and think about what we need to do before the heat even gets here. Because we are a few months away, but we need to start thinking about it now.
All right, that's great. So if people want to get a hold of you or the St. Francis, or they have any questions, can they get a hold of you guys?
So we have our St. Francis Family Medicine clinic. It is located at St. Francis Hospital. We are accepting new patients. We have a wonderful residency program with plenty of residents who would love to take on some new patients. So if you're not already established there, you can come and find us. Dr. Bargier, you're located a little bit further away from us now, but
Far away, and I
would
have
be
a
lucky
lot
to
of
have you.
patients already. If we're looking to find Dr. Brossman and the rest of our 17 wonderful residents, they're located in, let me see if I remember this from memory still, 701 North Clayton Street, and call 302-575-8040. All right, I'm going to bring back Dr. McDonough.
It's an important issue that's not going away. So in your own communities, you can try to do things work with the medical community and also work outside of the medical community and do it. And Dr. B, great job on the Delaware Academy of Family Practice podcast. Continued success to you. Dr. Brosman.
Yeah, good luck.
Success in
Good
your
luck.
career. Thanks, everybody. Dr. Brian McDonough. Thank you for watching the Dr. Brian McDonough Show. Until next time, stay healthy.